I'd like to also share a story of a patient of mine who came to me. She was a resident of an area near Bhopal. She'd got married to a colleague of mine, a friend of mine in Mumbai. So basically now she was going to be residing in Mumbai. She came to us after 3 years of having been married and not conceiving, with very irregular periods. And when she came to us, I remember having told her that probably this is about 7 to 8 years back, she would require to undergo laparoscopic electrocoagulation of the ovarian surface, which was called LEOS. So this surgery had to be undertaken for her ovarian status to come back to near normal. So she had a very strong PCOS, if I may call it that, because conception through normal conventional means was not possible. And surprisingly, within 3 to 4 months of having done the LEOS, she conceived spontaneously and came back to us for the antenatal follow-up. Now, the interesting thing was that when she came to us for the second or the third antenatal visit, she mentioned to me that I had told her during one of the consultations that polycystic ovary is commonly seen amongst female sibs. That means if she had a sister or, somebody from the maternal side, it is likely that polycystic ovary may be present. Now, she remembered that sentence and sought my consultation for her sister, who was going to get married shortly. And she too had the same problem and excessive hair loss. So her problem was really cosmetic. And coming from a very conservative family, she said probably she couldn't undergo the treatment that our patient had undergone, which meant that I probably should not look at laparoscopy. Now, I mentioned it to her that, the treatment that we will give her can also vary from patient to patient. Unless it is severe, we don't need to do laparoscopic ovarian drilling. So in this case, in her sister's case, when she came in for a consultation, I found that she was early PCOS and also shared the same thing. So here we managed to change some lifestyle-related things, put her on drugs, and she started cycling normally within the first 2 months of the treatment. And we managed to tell her that she can easily get married within the first 3 or 4 months after having taken treatment. The part that was very interesting was that after the girl had got married, her husband was very cooperative and both of them visited us. So we also recommended some some post-marriage counseling advice, and it seemed to work very well with them. And they were willing to wait to have a baby for 6 months, which was good enough time for her to get her cyclicity back. And this patient then spontaneously conceived, and the happy couple then came to us saying that you're one doctor who can do surgery for my elder sister, and for the younger sister, just simple medicine. So across the board, what they did was they spoke to a lot of other, friends of theirs who may or may not have had polycystic ovaries. So they were the brand ambassadors, or let's say the ambassadors for treating polycystic ovary. My feeling is that the earlier you get to treat a patient of polycystic ovary, and the more calibrated your approach, the better are your chances that a patient will conceive because of proper intervention at the right time. Thank you.